Hey all, welcome to ShareTreck, where science meets investing. I'm your host Raj, and today we are going to dive into CTX131, which is a next generation CAR T therapy from your favorite company, CRISPR Therapeutics. This therapy targets solid tumor, a space where most cell therapies have failed so far. Friends, I value your time, so I'll keep this video crisp and to the point. If you want any clarification and a deeper dive, please put those requests and questions in the comment section. I respond to everyone, so I'll take care of that. That said, let's get started. CAR T therapies have made huge strides in blood cancers. But when it comes to solid tumors like renal, lung, pancreatic, and ovarian, those are a different beast altogether. Combined, they account for over 90% of all cancer deaths worldwide. So that's a big number to tackle. In 2023, the global market for solid tumor therapies was estimated at around $182 billion. And it also had projections pushing past $300 billion by 2030. However, despite that size, CAR T therapies have struggled here. The tumor microenvironment is such that it suppresses T cells, and solid tumors often don't express a clear single target like CD19. This is the context in which CTX130 and 131 were born. CTX131 is a gene-edited allogenic CAR T therapy, meaning it uses donor-derived T cell, not the patient's own. That's what makes it allogenic. It's built using CRISPR-Cas9 edits to enhance function and durability. That's the gene therapy part. The therapy targets CD70, a protein expressed on many solid tumors, especially renal cell carcinoma, glioblastoma, pancreatic, and some head and neck cancers. But in this case, it's not just about targeting the right cells, it's also about survival inside hostile environment. That's where the gene edits come in. Cancer cells create a hostile environment and suppress the T cells. CRISPR Therapeutics edited 2 genes in these T cells in order to overcome solid tumor barriers. They knocked out a gene which is called Regnase-1. And this particular gene suppresses immune responses. Removing it from the T cells helps T cells expand more rapidly and stay functional for longer. The next gene knockout they did was TGFBR2. This gene responds to TGF-beta, a molecule that tumors release in order to suppress immune cells. Removing TGFBR2 lets the CAR T cells ignore these off signals and continue attacking the cancer cells. And the result? Stronger cytotoxicity, better persistence in the body, more resistance to tumor suppression. These are the 3 benefits. Coming up next, I'm going to talk in detail about CTX131 and how it differs from previous CRISPR programs like CTX130 and why it should matter to us as retail investors. So stay tuned, keep watching. CTX130 was the first gen CD70 targeted CAR T from CRISPR Therapeutics, but it had limitations, especially in cell persistence and expansion. When CRISPR decided to discontinue CTX130 and go for CTX131, I did not understand it completely and I was very disappointed. Now I understand. CTX131 builds on those lessons learned from CTX130, and with these 2 additional edits, which preclinical data shows leads to greater cell expansion, better in vivo tumor clearance, and lower exhaustion rate for T cells, makes it really worthwhile. Patients previously treated with CTX130 are now in long-term follow-up, but CTX131 is already showing stronger potential in preclinical models. I tried to find out what's happening with the clinical trial and where it stands. I found that CTX131 is now in a phase 1/2 trial for patients with relapsed or refractory solid tumors. The trial is evaluating safety and tolerability of the therapy. It's also measuring T cell persistence and expansion in the body. It's also looking at tumor response signals. These are early stage patients who have failed other treatments. So efficacy here, even modest, will be a major signal. And the trial is still ongoing. And I'm thinking that we can expect a clinical update probably in the late 2025, maybe towards the last quarter of this year. The question is, why is this program important for CRISPR Therapeutics? It shows they're not just a blood disease company. It diversifies their pipeline beyond Casgevy and CTX310. It puts them in a $180 billion market where cell therapies have yet to succeed. Most importantly, CTX131 could become a platform model. If it works for CD70, the same edits could be applied to other solid tumor targets. That's the long-term game that CRISPR Therapeutics is playing here. It's not without risks. The clinical trial, as it progresses, keeps on reducing the risk as we get positive data. Now, the question is, what am I watching next as a retail investor? Well, here are the key milestones I think we need to monitor. Phase 1 enrollment, patient safety data, and we have to look at preclinical models that may be released in scientific conferences. We have to also watch out in the press and also in the investor section of CRISPR Therapeutics to see if they are expanding into additional solid tumor types, if CD70 proves a valid target. Also watch out for partnership or licensing interest based on solid tumor data. If CTX131 performs well, it could attract interest from major oncology players. And I think that kind of brings me to an end of this video. And if you found this helpful, please share it with your friends and others who follow genomic investing. We do deep dive videos every week on companies leading in gene editing, sequencing, and biotechnology innovations. So if you subscribe and turn on notification, you will not miss what's coming next. Now, my question to you is, would you invest in a CRISPR-based solid tumor therapy, or is it for you too early to tell? Let me know in the comments. Until next time, stay curious and stay invested. Thanks and have a great day. Bye for now.